Good morning. Thank you very much for this opportunity to be here today. My presentation is entitled "The Science of Music in Medicine." During my presentation, I would like to give you a brief introduction on the history of music in medicine since the beginning of cultural history until today. I will show you some of our research on how music impacts on surgeons, on relatives of patients, and of course on patients. I show you the results of these studies and give you a brief summary at the end. This is from a French-German documentary on our research that nicely summarizes what we are working on. Maybe we can have the tone up a little bit. Medicine is a high-stress work environment. It's stressful for patients, it's stressful for relatives, and it's stressful for the healthcare professionals. And we are looking at how music can help with this stress and maybe even improve performance of surgeons. As you see here, this is a certain type of surgery called laparoscopic surgery, and I will show you some more about this during this presentation. So whensoever the evil spirit from the Lord was upon Saul, David took his harp and played with his hand, and Saul was refreshed and was better, for the evil spirit departed from him. So many believe that this is the oldest example of music in a therapeutic and a healing context. And this dates back to about 1000 BC. However, the oldest example of music in a therapeutic context dates to about 4000 BC, where it was believed that evil spirits can be averted by using music, and we know this from frescoes where harp-playing priests were depicted as musicians. The first explicit example dates back to about 2000 BC, where entire concerts were performed to avert evil spirits for the healing of the patient. And the healer, the priest, the physician was reimbursed also by a hallelujah from the patient, sort of where our medical system is heading towards today. The Pythagoreans were the first that were interested in how does music impact on humans. And they discriminated, for example, between hard, modest, soft, lascivious rhythms and rhythms that can be used for the education of children. And we know this from the Roman historian Anicius Boethius from around 500 AD. The state philosopher Plato believed that music is essential. It's essential for every state and very important for the education of the youth. And he believed that the euphony of the music counteracts the dichotomy of the soul. Seneca the Older, from around 1 BC, was a very careful observer of the circumstances at his time. And he said, I don't believe much in the qualities of the Roman physicians, and it wasn't until Greece was incorporated in the Roman Empire that Greek physicians who also used music came to Rome, that medicine overall improved in Rome. And as I mentioned, those Greek physicians also used music. In the Middle Ages, music, the study of music was a requirement for the study of medicine. And it's interesting that the application was already specific. Music was used to treat specific diseases such as psychiatric diseases, fever, delirium, or stroke. And for example, the alternating sound between the flute and the harp was supposed to help with gout. Good luck with that approach. Wouldn't try it at home. Even until the 19th century, it was thought that music acts through a magical power. And Hermann Hesse wrote along those lines, music has an elementary power and strong healing magic to it. More than any other form of art, it has the ability to supersede nature and to replace it. The first scientific experiments on how music acts on humans begins with this German physicist and philosopher and physician Hermann von Helmholtz, who wrote this work on the sensations of tone as a physiological basis for a theory of music. And he was the first who thought about how certain harmonies act on humans. And he was not only a gifted scientist, but also a creative inventor, and he invented this definable electrical tuning fork for his music physiology experiments. Where do we use music in medicine today? And I would like to focus the area where I work in, which is surgery. Music is used before, during, and after surgery successfully. And the first description of music being used for patients in the operating room dates back to 1914. This American surgeon Kane published his work entitled The Phonograph in the Operating Room, and he says in his paper he wanted to alleviate the horrors of surgery by using the phonograph for his patients. In the late 1920s, Farr described how music is successfully being used for patients who undergo surgery under regional anesthesia, meaning one limb is asleep while surgery is being performed. It took until the 1960s that music was increasingly used, driven by dental surgeons on the West Coast. And an important work is the one by Gardner, who has shown as a possible explanation how music might act therapeutic, that pain and auditory pathways are able to inhibit each other in the brain. It is important to understand, even under adequate general anesthesia, meaning you are happy as the patient, we are happy as the surgeon with the level of anesthesia, auditory information are processed. And to summarize what music can do for you while you undergo surgery and are under general anesthesia, it can reduce the need for medication, it can reduce hemodynamic variability, it can decrease postoperative pain, and it can speed up recovery. Music doesn't only act on the patient, but it also acts on us, the surgeon. And an interesting experiment was the one by Allen and Blaskowicz, who have shown that mental subtraction tasks are more accurately and faster performed if the surgeon listens to self-chosen music rather than experimental chosen music or no music. I would put, when you leave today, music in medicine in a mental category like a drug, like medication. There are effects, but there are also side effects. Vocal music, for example, is more distracting than instrumental music. The familiarity with the piece is important. Personal preference, although poorly understood, is very important, and it is closely linked to your primary personality, and so closely linked that it is used in psychiatry as a diagnostic tool. The noise pressure level, if too soft or too loud, can induce stress. Let me show you some of our research that looks at how music impacts on surgical performance. And what you will see here is, number one, there's surprisingly many parties involved in successful surgery. And this is a specific type of surgery called minimal invasive laparoscopic surgery, where there are tiny incisions on the patient, and they're very happy because they have very little pain from having only a tiny incision. Maybe we can turn off the music. As I mentioned, if the noise pressure level is too soft, it can induce stress in me. So what you see here, what it requires the surgeon to do, which is very stressful, you have to convert this two-dimensional image you see there on the screen into a three-dimensional motor performance, and it has been proven to be significantly more stressful than open surgery. So how does it actually impact on the surgical performance? How do we measure surgical performance? So there are two important components. One is speed, and the other one is accuracy. In order to address this question, we randomized volunteer surgeons into 4 groups: into a silence group, a dichotic music group, a mental loading group, and a Mozart music group, where we looked at Mozart's composition and had analyzed it for compositional elements of relaxation. What is dichotic music? It's 2 different types of music in each ear: death metal in one ear, German folk music in the other ear. Designed to be super stressful. The only reason it passed the ethical committee is because it has this euphemistic name, dichotic music. It sounds very nice. What is mental loading? mental loading means you are not focused at the task at hand. And we were not only interested in performance, but also the ability to recall what you learned. And we correlated all of this into, as you can see here on the left side, this brief musical experience questionnaire to correlate this to an experience of music in a surgeon's life. What are the results? Do not go asleep. This is an interesting slide, although I don't have a pointer. I wish I would, but I don't. Nothing points, okay? So look at those 4 groups here. You see again the silence group. And what you see is the first time this surgery is performed, people are not bad, and they improve a little bit when they perform it the second time. And one thing I think I should mention to you, there are very few patients who would sign up for having surgery done by a surgeon under dichaotic music stress. So all of this was done under virtual reality. So we have like 3-dimensional simulators. And how do we measure accuracy? So the instruments, those long laparoscopic instruments, have an antenna at the tip. So if an expert of surgery tries to grab the structure in the body, he goes in a direct line, versus a beginner, he does something like that. So the distance, the tip travels through space is longer. Let's look at the dichotic music group. It's interesting that there are some people who are 500% worse in comparison to silence, versus others, they are such as good as in silence. And we're looking at why that is and whether we can predict that. If you're mentally loaded, if you're not focusing on the operation you're doing, you are bad and you don't improve, you don't get better. Most interesting is this 4th group there at the end. The Mozart group is people are equally good to silence. There's no significant difference, but they improve the most if they're again exposed to music and do the same surgery again. So there must be a conditioning effect. And the graph on the left side is speed, and on the other side you see accuracy. Are you asleep yet, or no? You're asleep. Okay, very good. So let's move on. All those slides look a little bit boring, but that's how scientists talk to each other. But I hope I try to really explain to you what's going on. If you have a question in between, maybe I can address it right away. But so this experiment tried to address, can we predict whether relatives of patients who I find are under-researched in medicine can be helped with music? In order to address this question, we had relatives of patients waiting in the waiting area of our emergency room, waiting for their family member to be treated. And the minute they walked in, they got 3 questionnaires: a stress questionnaire, a music experience questionnaire, and a demographic survey. And then they would be randomized to 2 groups, one a music group and another group that wouldn't listen to music, just sit in the waiting area. And at the end of this 1 hour, we would again give them the stress questionnaire and the music experience questionnaire to see whether there's a change from baseline. So it wouldn't matter, if I come in shot in the chest by one of my unsatisfied patients, or someone broke his toe. It doesn't matter, because we're just looking at change from baselines. And the results are striking. There's a 10% decrease in stress level in the music group, versus in the non-music group, there's no stress reduction. Music, very cheap, however, very effective. The second line shows you that there's one specific component within this brief music experience questionnaire, the social uplift scale, which means you're moved by music in a group-oriented manner. So if you go to a concert and this gives you really a good experience that you're there with other people listening to music, then that correlates as very predictive of whether you will be relaxed listening to music while you're waiting in the waiting area. And Mea Menino addressed the issue of inequality, and our research has been criticized. We're only talking about Mozart, all those Harvard professors, we're playing Mozart too. Of course, it only acts on them. And it was a great result to find the last line you see there. It is different, inverse from how you would think it is, in that the lower your level of education, the more relaxed you will be by Mozart music. And I find this very interesting, and our group is working on this as we speak to find out why that is.
Patient's heart rate tends
This is an intensive care nurse.
their blood pressure can go up.
I wish you could hear what she says.
And they can get quite agitated, so
She talks
they'll be
about
riled up, trying to
patients
get out
in
of
the
bed.
burn
They're
intensive
just
care unit.
very stressed in that sense.
And what she said is that the severe illness, the lack of day-night rhythms, they developed something called ICU delirium. And we tried to look at not only can we use music to help those patients, but also how does music act relaxing in the body. Why did we choose this group of patients, those intensive care patients? Because those are under a tremendous amount of stress. We thought that with the techniques we have today, the changes we can measure through music would be very subtle. So we would have to use a group that would be under a tremendous amount of stress in order to have an effect. So the question was, how does music achieve relaxation? You would think this is a pretty basic question. This should have been addressed before, right? Because usually how medicine works, if you think you have a cool idea, you go to the computer and type in your idea, and you will find that 100 other people have looked at it before, much more scientific than you thought of. This is not the case for music and medicine. I encourage the young people in the audience, if they are looking for a field they would like to do research in, tremendous innovation, simple, basic, fundamental question can be answered in this field. So in order to answer this question, how does music act relaxing when you're listening to it, we randomized intensive care patients to two arms, a Mozart arm and a no music arm. And those patients would all be on the ventilator, just had a really big operation, and we would stop sedation at time 0. The patient would wake up, and we would then either give them music or no music, and then we would, before and after the intervention, we would measure parameters of the human stress response in the body. And during the entire time, we would record physiologic parameters. So what are the results? And I'm summarizing this in this slide here. How does music act relaxing? So music acts in the brain on several levels: an aware cortical level, an unaware cortical level, a subcortical level, and a very rudimentary level of awakeness. And then we found this very interesting result where we at the beginning thought we made a mistake, we mixed up the groups, and that growth hormone, which is a hormone secreted from the brain, is upregulated. Usually it's associated with relaxation and it's downregulated. But at the same time as we were conducting those experiments, a competing group showed that cells of inflammation, you see there on the left hand, have a growth hormone receptor on the surface, and when growth hormone binds, the major mediator of the human stress response, interleukin 6, down there, chemical cells used to communicate with each other and convey that there is stress going on, was downregulated. And that was exactly what we found in our group. So when interleukin 6 is downregulated, your adrenal gland secretes less stress hormones such as epinephrine or dehydroepiandrosterone and other stress hormones. And as a result of that, we can measure all those beneficial physiologic effects such as better heart rate, improved blood pressure, less need for narcotics, and an improved level of sedation, because the nurses didn't know whether music was being played through the headphone, and we asked them to grade them on a standardized sedation scale, and they graded the patients they were listening to Mozart as more relaxed. Let me summarize what I've shown you today. I've shown you that music as therapy has a long tradition, but there are surprisingly few scientific effect studies. I've shown you that music has positive effects on intelligence, on concentration, on memory consolidation, and on relaxation. And those effects are measurable, those physiologic and serologic measures. So blood pressure, heart rate, those are physiologic parameters, and serologic parameters are those hormones and interleukin 6. Those are measurable effects. But I think in order to convey to physicians today that music is a very simple, very cost-effective measure to help patients, to help relatives, and even us clinicians. I think then there's a need for more scientific effect studies in order to convince those physicians to use music more. I would like to thank you for your attention.